So it's the cup. I always talk about a cup. You have a migraine cup, okay? So your migraine happens when this cup overflows. And the choices that you make can either, one, lower the water in your cup so that it doesn't overflow, raise the water in your cup so that it overflows, or most importantly, what we want to do in vestibular rehab is make the cup bigger so it can hold more water. That way we've actually created a higher threshold for migraine attack. We want to make this cup bigger so that you can handle the stress at work, the loud noises, the kids constantly asking for things, because your cup is bigger. You can hold more water, you can hold more stress before we overflow into active migraine. And that's how I allow them to visualize why I'm having them do these things that I'm having them do, because nobody likes lifestyle management unless they understand the purpose, because lives are hard enough as it is, and I'm going to make it a little bit harder by cutting things and adding things. There are environmental things and lifestyle things that fill the cup up. So these are the triggers. These are what make you reach your threshold faster. It can be sensory overload. So this can be modifiable by using sunglasses when you're outside, using potential fluorescent light blocking glasses when you're inside or doing a lot of computer work, making sure we don't have a binocular visual dysfunction where your eyes are constantly straining to have to work together. And we're going to talk a little bit about that. If you're in a really loud game, your kids play basketball, you're in an auditorium, there's tons of people, can we put noise canceling earbuds in so that it's not so loud? Motion sensitivity. So frequent positional changes, we want to train that, but we also have to understand that these frequent positional head movements fill up that cup. That's a trigger. That's a stressor. Noxious stimuli, visual vertigo, busyness, stress at work, stress at home, internal stress, poor sleep in the number of hours. And usually I always tell patients, if I'm thinking there might be a sleep problem, it's not always, or usually the night before the ictal event, it's 2 nights before. It's 2 nights of bad sleep, where it's 2 nights ago, my daughter didn't sleep well, then I had a really bad day at work. I got to bed late the next night, and then bam, huge ictal day following 2 nights of disruption. Diet can be from an inflammatory marker, but also vestibular migraine in general. Some people have some weird dietary quirks. And I'll talk about my stance on diet, but it is my last go-to. I will approach the Mediterranean anti-inflammatory diet because I think that's just a healthy diet people should know about, they should follow. Shop on the outside of the grocery store. If it comes in a box, it's probably bad for you because it has preservatives and things that are messing with your brain. That's an easier sell. I don't tend to put people down the road of, is it bananas? Is it avocados? What's your one migraine trigger? That's a really slippery slope. It's hard to figure out. It's stressful. And there's so much more we can do that's more beneficial starting out than to start with diet. So I usually am big on sleep. I'm big on stress. I'm big on dehydration. Those are the ones that I tend to start with. So these things fill your cup up. And they have to understand that they fill their cup up so that they can create choices on how to limit or improve or control these types of lifestyle and triggers. So this one makes your cup bigger. So if we do these things, our cup is larger and we can tolerate the noise. We can tolerate the busyness because our cup is bigger and it holds more water. It holds more triggers before we overflow into active migraine. Sleep hygiene is huge. So going to bed and waking up at the same time is part of sleep hygiene. It's not just 8 hours of sleep, but it's a sleep schedule. And then it's getting your 6, 7, 8 hours, whatever's normal for that person, very consistently. This is a very hard discussion to have with a mom with young kids. Because yeah, sleep would be great, but do you have a 2-year-old at home that doesn't sleep? And there's a ton of grace in that, and you control what you can control. And sometimes it's, can your husband take one night? Can he just give you one night a week that you can really hone in? And it's brainstorming with them on what works for their life. Stress reduction, management, and meditation. So sometimes this is another thing that people are like, yeah, my work is super stressful, but unless I quit, I can't get out of that. So it may not be changing the stressor, but changing the management of the stress, stepping away, meditation, our breath work, our anxiety work that we did from 3PD can also be a moment during the day where we de-stress. We do box breathing. We just remind ourselves, set a timer every 30 minutes. I'm going to step away and I just need to calm it down. And so that can be helpful, and it doesn't change the stressors, but it improves the management of it. Probably second most important under sleep in my mind is regular exercise. And if you tell a working mom that they need to exercise more, that is not an easy discussion, because of course they would if they had 12 more hours in the day. That's where the discussion is. This is so important. How can we work it in? If you're taking kids to soccer practice, instead of sitting on the sideline or working in the car, can you walk around the field? Like, how can we integrate more steps in your day, get your heart rate up? And how do we do that without triggering migraines? So usually I'm not telling a patient to go run, because if you go run, you're probably going to trigger a migraine in some patients. Some can tolerate it, some can't. I like to just do walking on a treadmill if you can, or walking uphill. It tends to be more aerobic, it's more taxing, but it doesn't give you so much bounce of running. If they're around the soccer field, then I'm like, just walk around the soccer field. It's fine. Speed walk, just try and get your heart rate up. I like using resistance training if they have access to that. Sometimes I will find some nice videos online that have the entire intensity exercises, like the HIIT style, where it's 30 seconds fast, 30 seconds rest, that they can do on YouTube, on the sideline, or in their basement. It takes like 20 minutes. They're designed for like people who don't have a lot of time. I'll pre-screen them to make sure. Sometimes they'll be like a downward dog or something I don't want them doing. So I'll be like, do this video, but instead of this, I want you to do like fast sit to stands, or I want you to do a plank, or I want you to do a sustained bridge, and modify it so that they're getting strengthening, they're getting intensity, but it's not so much of a head down position or whatever I think their trigger might be. There's so many free HIIT videos on YouTube. I use those all the time. It's a quick, here's the link. It's on their phone wherever they go. And they're pretty good at getting heart rate up in a short amount of time. Hydration, pushing fluids, keep a water bottle on you. If you don't have a water bottle on you, it's really hard to drink water. Sometimes it's just a reminder to take it with you, and then out of convenience, it gets drank. Visual assistance, migraine glasses, our blue light blocking glasses. This FL41 is what you're looking for if you're going to purchase these. They're on Amazon all over the place. If you've ever been to a conference, you've seen TheraSpecs. This is basically what TheraSpecs are doing. They're like a rose-colored glasses, so like a little Elton John look going on, but they're effective. People are always like, I already have blue light blocking glasses. But if you actually look, the blue light blocking glasses that you get at like the drugstore or the fashion glasses you can order online typically block 15% of the blue light. These particular glasses block 80%. So it's a totally different ballgame. They are orange, so that's a sell. I have one brand, Bradle and something on Amazon that I always purchase. I've had multiple patients have success with them. That's why I stick to that brand, because you never exactly know what you're buying on Amazon. So this brand has given me success. And then eye breaks. So migraineurs struggle with visual attention, especially up close, especially on screens. So every 20 minutes, you need to look at something at least 20 feet away for 20 seconds. Just allowing the eyes to relax does a huge amount of reduction in stress on the brain, especially if there's a visual dysfunction or like binocular visual dysfunction happening. And then the diet, a Mediterranean diet. If you're looking for an easy discussion to have, these are 2 cookbooks that were made specifically for vestibular migraine. Alicia Wolf has severe vestibular migraine and partnered with Dr. Bay, and Dr. Bay is a famous vestibular migraine neurologist in our country. And they came together and wrote these 2 cookbooks for vestibular migraine. The Dizzy cookbook was her first one. The Mediterranean diet was the second one after she had kids. And so it's tailored more to the casserole, like the quick feeds a lot of people. It's easy to make. It's a one dish kind of meal. So I tend to lean more towards the Mediterranean diet cookbook, but they're both great resources for patients. Again, you can just give them an Amazon link and they're right there.